What are the 5 stages of dying? Denial, anger, bargaining, depression, acceptance. In a cardiac arrest, what is the usual dose of epinephrine? 1 milligram IV push every 3 to 5 minutes. The order is to give a combination regular and NPH insulin. How do we draw the mixture? Draw the regular first, then the NPH. A patient is in the anuric phase of renal failure. How much urine output would we have? Less than 100 cc's in 24 hours. A client is in the oliguric phase of renal failure. How much urine output would we have? Less than 400 cc's in 24 hours. What is a pulse deficit? The difference between the apical and radial pulses taken at the same time. When should postural drainage be done? Before meals or 2 to 4 hours after meals. What is a positive Kernig sign? An attempt to flex the hip results in painful spasms of the hamstring muscle, usually in meningitis. Where is the most common location for a herniated disc? L4 to L5, L5 to S1. What is Valsalva's maneuver? Forced exhalation against a closed glottis. What are the early signs and symptoms of alcohol withdrawal? Anxiety, tremors, insomnia. What is the main reason for pain in angina? Ischemia of the myocardium. What position should the nurse place the client with the Sengstack and Blakemore tube? Semi-Fowler's. What is intermittent claudication? Pain in the leg during ambulation that is relieved with rest, usually a symptom of arterial insufficiency. What is the most common symptom of bladder cancer? Painless hematuria. What does a positive Trousseau sign suggest? Hypocalcemia. What does a positive Kvostek sign suggest? Hypocalcemia. What is the priority intervention in a burn patient? A patent airway. What is the best time to apply elastic stockings? Before the client gets up from bed. What is the treatment of choice for gonorrhea? Penicillin. What is intractable pain? Pain that can't be relieved by drugs. When is informed consent required? In any invasive procedure. How do miotic medications reduce intraocular pressure in clients with glaucoma? By constricting the pupil and increasing the outflow of aqueous humor. What would the widening pulse pressure suggest? Increased intracranial pressure. What is the purpose of the mist tent? To liquefy and loosen secretions. What is the classic symptom of pleuritis? Chest pain that increases with respiratory movement. When a client is in shock, what causes cool, pale, diaphoretic skin? Diversion of blood from the skin to major organs. What is normal capillary refill? Less than 3 seconds. What is the cardinal sign of toxic shock syndrome? Rapid onset of high fever. What is the classic sign of peritonitis? Rigid or board-like abdomen. What does a frothy blood-tinged sputum suggest? Pulmonary edema. What are the advantages of pursed lip breathing for a client with emphysema? It slows down respiration and prevents alveolar collapse. What are the side effects of antihistamine medication? Dry mouth, drowsiness, blurred vision. How long will a post-op client who received general anesthesia be NPO? Until a gag reflex is present and bowel sounds are heard in all 4 quadrants. What does an elevated prostate-specific antigen, PSA, suggest? Benign prostatic hypertrophy. What effect does mydriatics have on a client's pupil? Dilatation. What is McBurney's sign? Right lower quadrant abdominal pain. What is a chancre? A painless lesion during the primary stages of syphilis. What is the best indicator of effective total parenteral nutrition, TPN? Weight gain. What are the preferred sites for bone marrow aspiration? Iliac crest, sternum. What is the antidote for heparin overdose? Protamine sulfate. What is the definitive diagnostic test for Hodgkin's disease? Lymph node biopsy. In Bell's palsy, what causes the unilateral facial weakness or paralysis? Disturbance of the 7th cranial nerve. How do people die from botulism? From respiratory complications. What is the most common blood transfusion reaction? Fever. What side should a cane be carried? The unaffected side.